Ethambutol. These are orally active. And finally one more injectable, that is streptomycin. These 5 drugs, sometimes 4 drugs also are to be given. These 5 drugs or 4 drug therapy is to be given for 2 months, followed by combination of 2 or 3 drugs for rest of the 4 months, which is effectively able to eradicate drug sensitive tuberculosis. If it is a drug resistant, which could be rifampicin resistant Mycobacterium tuberculosis, or it could be a multiple drug resistant MDR TB, what we call as, or it could be XRD also, right? Such cases, combinations and drugs are different, which we will learn in the upcoming slides. But remember that to overcome these obstacles which you have learned as a characteristic of Mycobacterium, and to prevent the emergence of resistance during the course of therapy, you need to give a combination therapy. It is must, right? Single drug is not able to cope up with the Mycobacterium in the human body, and that's why you need to give at least 2 drug or more drug. We need to be very aggressive in therapy of Mycobacterium, right? So if you maybe say, for example, if it is a subtherapeutic dose, if you have skipped the doses, or maybe if the duration of the therapy is lesser, is not being followed properly by patient, such a case, Mycobacteria is very notorious with its ability to develop the resistance, which we'll learn individually in the individual drug therapy for tuberculosis. Okay, so this is the reason why government or WHO has forced the DOTS therapy, right? So DOTS therapy is basically a family member or friend will be just monitoring, because the drug therapy is quite long, right? You need to have a person who monitors and who just continuously give you advice, right? You have to take the, even nowadays the system of healthcare centers, that they also do have a continuous follow-up, right? You even sometimes you have a because that numbers which are given on the capsule, which you need to give regular follow-up by health centers. This data will be because that sent to the taluka places or district places, and then finally to the state level, right? So they just track all the data, right, regarding the usage of the drugs, right, which are given to the patient, right? Considering that this disease is specifically is occurring in those people who are living in poor hygiene, right, slum areas, right? That's why this disease is considered as a you can say that disease of poor people, right? And that's why you find the epidemiology in either poor countries or in the developing countries, right? We recently are having the problems of COVID-19, right, which is pandemic, but tuberculosis is from years, right? It is epidemic, it is pandemic in Asia, countries of Asia, Africas, and lots of death. It is the most because that is the highest, right, cases of infections, right, in the last few decades. They have been due to tuberculosis. So a very important disease, right, that we have discussed, right? So just go through the characteristic of Mycobacterium. That is the very important basis for the question that have been asked in the GTU, that is why combination therapy has to be employed in the treatment of tuberculosis, right? The answer lies in the characteristic of Mycobacterium, right? Moving toward the next slide, the diseases which are caused by Mycobacterium. I would like to classify Mycobacterium species into 2 categories. Typical Mycobacterium species which can cause these 2 diseases. So Mycobacterium tuberculosis, and second is Mycobacterium leprae, right, which causes leprosis, right? These are typical Mycobacterium species. Also there is one more which is atypical. Atypical means not normal, it is not found as a disease, right, in the general population. That is called as a Mycobacterium avium, right, and that disease is called as a Mycobacterium avium complex disease, right? So but yes, this is very important in the patients of HIV, right? It's also the tuberculosis, right? You will check, if you just check the clinical scenario, you will find lots of disease in the HIV, but then tuberculosis, atypical Mycobacterium, that is Mycobacterium avium, these are found in the HIV patient, right, which we'll check again in the clinical scenario, right, once we check the details of drug. Okay, so starting with the brief pathophysiology of tuberculosis, Mycobacterium infection, it is caused by a bacteria, that is your Mycobacterium tuberculosis, also called as a tubercle bacilli, right? And you must be knowing that first vaccine that you receive after your birth is BCG, right? It is to give protection from this tubercle for initial few months of your life. Okay, now this bacteria is usually transmitted by droplet mode, right? So that is by cough, sputum, or you can sneezing of the patients who are having Mycobacterium tuberculosis, right? So such a case it could be spread, right? And it damages primarily a person's lung, right? Lung, because the partial oxygen pressure in lung is quite high, so the bacteria is having a characteristic to have a very good growth where in the areas where PO2 values, partial oxygen pressure is high, right? So initial, because it is been transferred by droplet mode, that's why initial infection is found in the lung, right? But it is possible that bacteria may survive and grow in the lung, or the initial infection will not produce damage in the lung, it will migrate in other areas of your bodies where it will produce a secondary sort of symptoms, right? Maybe the infection could be in case of kidneys also, where there also PO2 values are quite high, or some of the other organs also, right? Like brain, like your bones, maybe in case of abdomen, right? These are some of the other organs also where the infection could be found, right? It is fatal if not treated properly, right? You must have learned one terminology in your vernacular language, Gujarati, that tuberculosis is called as a kshay, right? Kshay means it is determined that person is going to have death, right? That's how the name was decided, because at that time in 1930s, 40s, 50s, you are not having any chemotherapeutic protection against the tuberculosis. Fortunately, right now we do have, and that's why we are able to cope up with the tuberculosis. Remember that it is a treatable disease nowadays. Okay, moving towards the symptoms of the tuberculosis, it is continuous cough, right? Perpetual cough, fever, weight loss which is a characteristic one, 10% or more than 10% of the weight loss. If there is a continuous coughing which is not normally treated by regular whatever medicines we are taking as an anti-cough medication, right? And that case is, if it is along with fever and a sudden weight loss within few months, 1 or 2 months, if you have more than 10% deviation, it is surely indicating that it could be a tuberculosis. Such a case, the diagnosis for tuberculosis has to be proceeded, right? Similarly, night sweats, loss of appetite, fatigueness, swollen gland, chills, pain while breathing, these are very common symptoms you will find in the patients of tuberculosis. Moving towards the next slide. Yes, as I told that now TB is curable, right? And the reason why it is curable is now we have chemotherapeutic drugs, right, which are effective against the tuberculosis, Mycobacterium tuberculosis, right? So these are the first line agents which you call as an anti-tuberculosis agent. Okay, so 5 drugs are there, right? I'm starting with the first one, that is Isoniazid, Rifampicin, Pyrazinamide, Ethambutol, and streptomycin. Last one is given by injection. Rest of the 4 are given by oral tablet, right? Normally, as I told you, that initial 2 months, if it is a drug sensitive Mycobacterium tuberculosis, you need to give combination of these 4, or maybe the 4 that could be including in case of in replacement of pyrazinamide, it could be streptomycin. But if you check the dose of individual drugs, right, normally isoniazid is being given as a 300 milligram typical adult dose. Similarly, rifampicin, it is a 450 milligram dose, right, or 600 milligram dose. Similarly, for pyrazinamide, ethambutol, the doses are quite high, and if you combine these doses, it will put up somewhere around 1.2 gram, 1.3 gram weight. This is only weight of API, active pharmaceutical ingredient. If you add excipients, right, the dose or the weight of total tablet, it's quite bulky, right? It's just like a veterinary tablet. And that too, just to mention that rifampicin, because of its typical absorption criteria, it needs to be given on empty stomach, because it needs to be given, and you are giving a combination therapy. Normally we give a single tablet which is having these 4 ingredients, right? So such a case, 4 APIs, so such a case, a 1.3 gram 1.4 gram tablet need to be given in morning on empty stomach. This is also one of the reason that why patient compliance is poor, right? We will discuss that patient counseling and the role of pharmacist here is very critical. Role of physician, role of pharmacist regarding counseling is very critical, right? So such a case, this need to be, you can say that, emphasized, right? Need to be considered. Fine. So why we consider this as a first line agent? Because their effectiveness is very good, right? Their MIC values in laboratories are quite lower. Safety and efficacy in vivo, it is very good. That is why we consider it as a first line agent, right? But if somehow there is failure of response, then you need to go for a second line agents, right? So we'll check first in which condition second line agents are to be preferred. Okay, so first, in case if there is resistance to first line agent, we discussed that Mycobacterium tuberculosis is very notorious to develop its resistance. Such a case, if resistance is found to the first line agent, you have to move towards less efficacious drug, right, which are having what we call as an comparatively moderate or high toxicity. First line agents, they are highly efficacious with an acceptable toxicity. Second line agent, efficacy is good or it is slightly less as compared to first line, but then you have